Welcome to our COVID support webinar for soft play and other family entertainment venues. We hope that you're all safe and well and that you're pleased with the government's Stage 3 roadmap announcement. During this webinar, we will be looking at the replacement regulations and guidance specific to your industry. Our focus today will be around Stage 3 of the government roadmap. We will offer you support and guidance on how to operate safely during the pandemic, whilst allowing you to protect yourself and others around you. We will focus on key changes and restrictions, risk assessments, cleaning, testing and vaccinations. After you have viewed this webinar, should you have any questions, please make contact with us via our COVID Business Support email address, which is covidbusinesssupport@wolverhampton.gov.uk. We will also upload an FAQ document and a link to this presentation via our Trade with Confidence page at www.tradewithconfidence.org.uk. Now, as you're all aware, the government issued a roadmap for the easing of restrictions and have confirmed the reopening of indoor soft play areas and other family entertainment venues for Stage 3, the 17th of May. The next announcement on the Stage 4 restrictions is due on the 14th of June. Many of you will have an interest in terms of capacity and social distancing potentially being relaxed. We cannot confirm at this stage what the exact proposals are moving forward. Government have reminded us to remain vigilant and that COVID is expected to be here with us for a while and should fall as part of your everyday business as usual. I wanted to let you know that the current rate set at the 15th of May is 15.6 per 100,000 cases, which is great news for the city. As many of you will know, our rates within the city peaked to just over 1,000 per 100,000 persons back in January. We do appreciate that you'll be busy over the next few months and urge you to take on board the following measures to assist with the government roadmap and easing of restrictions. Many of you will have seen our COVID compliant stickers located within businesses across the city. The City Council introduced our COVID compliance recognition scheme to acknowledge the good work of those businesses and to provide the public with a level of reassurance that these businesses are safe to visit. We've carried out nearly 3,000 visits since the scheme was introduced, with our efforts initially being focused on the retail and hospitality sectors. The success of the scheme means we are now looking to open this up to other sectors, including yourselves. To receive your recognition sticker, you will be required to have adequate infection prevention and control measures in place, including a COVID-19 risk assessment, and a site visit will be undertaken by a professional officer within the service. You are also required to maintain and adapt these standards as we move through the stages of the government roadmap. Should you comply, these details will be listed on the council website as a COVID secure premises. We would also encourage you to display your sticker in a prominent position so that it can be easily identified by members of the public. Now, what is a risk assessment? Broadly speaking, a risk assessment is a careful examination of what, in your work, could cause harm to people, and the ways that you can successfully manage these risks to avoid this harm from occurring. As a responsible person, you must conduct a risk assessment to understand how the virus could be transmitted in your premises. You should think about the way that you conduct your work, how your premises is used, and ways that you can protect yourself and members of the public by identifying factors that could result in transmission of the virus. By identifying these hazards, you can then identify sensible measures to control these risks. An example of a hazard would be touch points such as door handles, slides, climbing frames. These touch points create a risk as the virus could be present on these surfaces. To avoid this risk, touch points should be wiped down frequently, and anything that is unwipeable should be single use, removed or quarantined between uses. Now, many of you will have been closed for a number of months now, so it is vital that detailed assessments are carried out before reopening and before things are put back into place for public use. Equipment may have corroded, there may be a change in characteristics of lubricants, and your daily, weekly or monthly checks may have been missed. It is essential that these checks are carried out. Water system stagnation can occur due to lack of use, increasing the risk of Legionnaire's disease. You'll need to flush the system, including the running of all taps, for a minimum of at least 5 minutes. This will flush through any bacteria. A link to the HSE website with further information and actions to take with regards to this will be provided by the FAQ document. Please also ensure that you carry out a full pest check of the premises for any infestations and seek advice from your pest control operative or environmental health officer should you need to. To assist with the NHS Test and Trace service, you are legally required to display the NHS QR code poster. These have recently been updated, however your old posters should still work for you. We will provide you with the link to download your unique QR code in the FAQ document. Please remember to display this in a prominent position at the front door or reception desk. Every customer or visitor aged 16 and over is required to check into your venue or provide their contact details. Many of you will have already have a booking system in place where you record individual details. These should be kept securely for a minimum of 21 days to assist the Test and Trace team. It is now a legal requirement for hospitality venues, which applies to you as providers of refreshments, food and maybe even alcohol, to refuse entry to those who refuse to provide their details. The financial penalty for you for a first offence is £1,000. Your records may be requested from the NHS Test and Trace service relating to specific times and dates. You must provide them with your logbook of customers to assist in tracing those affected. Your venue details will remain confidential. You must also assist the Test and Trace team by keeping a temporary record of your staff shift patterns for 21 days and assist the NHS Test and Trace service with requests for that data if needed. This could help to contain clusters or outbreaks. Please ensure that all visitors also comply with these requirements, including your local environmental health officer, pest control and engineers. COVID is carried in the air through tiny droplets. Larger droplets can land on surfaces that they touch, while smaller droplets, called aerosols, can stay in the air for at least 5 minutes if there is no ventilation. Therefore, cleaning your premises is a crucial part to achieving compliance and controlling the spread of the virus. You should implement a strict cleaning regime focusing on touch points such as doors, handles, slides, monkey bars, tunnels, taps on all hand wash basins, card machines and tables. We recommend that you have a designated member of the team who takes sole responsibility for these tasks and that frequency is high, especially during busy periods. For temping bowling sites, between bookings of lanes and use, you will be required to clean temping balls. Provide one ball to be designated per customer for their sole use during their allocated time and place hand sanitising stations to each lane at the table or seated area. Do not have temping balls lying around for people to use freely. For sensory rooms with items that are hard to clean, we advise you to remove these items or for quarantine between uses. Ball pits should be taken out of use at this time and role play props should be single use or clean and quarantined between uses. For those of you with pool tables or similar, these should also be included and carefully considered. You should continue to use your normal cleaning products that you have been using. However, there is a British Standard product referred to as BSEN 14476 that is recommended, but this is not compulsory. It only becomes compulsory to use this product when you are reacting to an outbreak. The guidance stipulates that you should carry on with your normal everyday disinfectant and sanitizer. Please do be mindful of children when cleaning equipment and touch points. Ventilation should be used as a key control measure to reduce the risk of aerosol transmission of COVID-19 in enclosed spaces. Ventilation will not reduce the risk of droplet or surface transmission, so other control measures such as cleaning and social distancing are also required. There are different types of providing ventilation, including mechanical ventilation using fans and ducts, natural ventilation which relies on passive flow through opening doors, windows and vents, or a combination of the two. We strongly advise that you keep doors and windows open for at least 5 minutes at the end of the working day. Now, social distancing is where you keep a safe physical distance from others outside of your household or support bubble. To allow for this, you should look at reducing your capacity levels, staggering arrival and exit times, and placing floor markings and signage throughout the premises. You should also look to introduce one-way traffic routes with people entering and exiting through separate doors to avoid mixing. Bookings are strongly advised but are not compulsory, and we ask that you ask your customers to arrive at the time of their booking, no earlier, no later, to assist with pinpoints and congestion of people. It is also a good idea to stagger these arrivals and to provide time limits on their stay. A wristband system may assist. Toilets should be well managed, looking at cubicle numbers and space available for people to use these areas and suitably distance themselves from others. You should have a strict cleaning regime in place, hand cleaning and drying supplies available, and hand sanitising station points. Think about parental supervision and spectator areas, and look at how you will manage these. Now, stage 3 restrictions. Who can come to your venue in stage 3? Indoors, groups of 6 or 2 households. This can be a mix of households within the group of 6, and 2 households can make up more than 6. Children are included within the rule of 6. Ensure that you think about safeguarding concerns such as children who will need to be supervised by their parent or guardian. They will need to be included within the group size if so. You may have a scenario where parents or guardians wish to sit and spectate or be on site. I would advise that you have this within a designated area and that social distancing rules apply. A cafe may be the best option to accommodate this, or to ask them to remain outdoors within their cars. Now, stage 3, service of food and drink. Many of you will offer hospitality services such as food and drink. For those of you who are unlicensed, the ordering and collection and payment can be made to the counter area and consumption will take place while seated. For those of you who are licensed, table service must be in operation at all times for ordering, serving and eating or drinking, and patrons must be seated at all times. There is strictly no vertical drinking or eating. There is no formal requirement to have tables alongside chairs. The requirement is simply to be seated only. Now, where you are already using PPE in your work activities to protect against non-COVID-19 risks, you should continue to do so. COVID-19 is a different type of risk to the risks you normally face in a workplace and needs to be carefully managed through social distancing, hygiene and fixed teams or partnering, not through the use of PPE. Workplaces should encourage the precautionary use of extra PPE to protect against COVID-19 outside of clinical settings or when responding to a suspected or confirmed case of COVID-19. Unless you are in a situation where the risk of COVID-19 transmission is very high, your risk assessment should reflect the fact that the role of PPE in providing additional protection is extremely limited. However, if your risk assessment does show that PPE is required, then you must provide this PPE free of charge to workers who need it. Any PPE provided must fit properly. By law, staff and customers of venues that provide food and drink will be required to wear a face covering unless they have an exemption. By law, all businesses must remind their customers and staff to wear a face covering where required. For example, by use of displaying posters or providing verbal reminders. You are expected to wear a face covering before entering any of these settings and must keep it on until you leave, unless there is a reasonable excuse for removing it. You may wish to implement screens to any till or counter area, which will also allow staff to remove their face coverings whilst working behind these screens. A full list of exemptions can be found online at the gov.uk website. It is important to note that a face visor or shield, often seen to be worn by many, may be worn in addition to a face covering, but not instead of one. This is because face visors or shields do not adequately cover the nose and mouth and fall below the chin securely. Please inform your customers of this requirement should there be any concerns. Penalties for non-compliance are £100 for a first offence. Hand washing is a key control measure to help to prevent the spread of the virus. You should ensure that you have a designated hand wash basin or basins located in convenient locations with a supply of hot and cold running water, liquid soap and paper towels for hand drying. Hand sanitising stations should be placed at the entrance, toilets, workstations and other areas throughout the premises. You should request that customers and visitors use these as they enter. Staff should be actively encouraged to wash their hands as often as possible and for at least a minimum of 20 seconds. Now, other areas for you to consider. Remember to include breakout rooms and common areas such as cloakrooms into your cleaning regimes and actively encourage staff to clean down touch points between uses. Examples of touch points are kettles, microwaves, fridge door handles, and have designated lockers for designated staff, if possible, asking them to lock away all of their items. Staff should be encouraged to wear a work uniform, which should be changed into it as they arrive on site and either washed on site or taken home and replenished daily. Meetings and training should be held via alternative means, via online platforms as an example, and any work-related travel should be alone. It should not be via car share, and where public transport is used, please remind staff to wear a face covering as required. Communication is a key element during the emergency period and as we work through the restrictions. To both your customers and your staff members, we strongly advise that you post your communications of COVID-19 measures via your social media pages or emails, and that you have staff debriefs before reopening and as we progress, which is essentially training sessions. Self-isolation. You as a responsible business operator have legal responsibilities to ensure that staff are isolating as and when required. Both yourselves and your staff are liable for financial penalties in the form of a fixed penalty notice if you fail to comply with this requirement. Please note that this also includes for agency staff. Smoking shelters or areas for staff should accommodate social distancing, and we encourage staff to take breaks sporadically. Please always remember hands, face, space and fresh air. Now, in terms of vaccinations, over 135,000 people in Wolverhampton have now had one dose of the vaccine, and 73,000 have had their second dose, totalling over 194,000 doses given in the city. The vaccine will reduce the chance of people suffering from severe illness and reduce hospitalisation. So when you are contacted by the NHS, please do say yes to a vaccination. Now, with regards to testing, these slides show local testing centres for rapid testing across Wolverhampton for people with no symptoms of COVID-19. When testing, a key thing to remember is that recording of a negative test is as important as a positive test result. The results will give us vital data and information to monitor and to keep on top of the virus locally within the city. To get back to some normality, it is important that we test ourselves at least twice a week, as 1 in 3 people have no symptoms of COVID-19. So testing continues to remain as important. Now, with regards to home testing, these slides also show where you can access home tests across the city, including pharmacies, and really does support how testing has been made easier. I urge you to check out the links provided in the slide, as there are quite a few venues where tests can be accessed. If you do have symptoms, these are the current testing sites across the city. All these venues need to be pre-booked. However, you can walk up to the Falkland Street car park and request a test. Please do make sure that if you have any questions or concerns, we will be happy to help you. And please do make contact with us if you need it. I thank you for your time and for listening here today. We do wish you all the best for the reopening of your business, and we do look forward to seeing you in the future. Please remember, as always, to be safe and be kind.